the reason we preach prevention, one of the ways you can prevent, to ensure you're into safe sex. That means you use protection. As a matter of fact, in the program, we have something we call ABC of HIV. The A means abstinence. Abstain. Abstinence is what we preach. Then the B talks about be faithful to a partner that is faithful to you. I don't know how we want to go about that. And then the C talks about the use of condomizing. It's what we preach in the program. So prevention, they always say, is cheaper, it's better, but I would say it's actually cheaper also, because the medications we use for HIV are quite expensive, and that's why we are still donor dependent, in the program. If we are going to calculate what it costs an HIV positive patient to be on drugs, and remember, these drugs, because it is not a cure, it is just a management, so the patients are going to be on drugs all through life. That's why we preach prevention. HIV and AIDS. So the simple difference: HIV is the early stage of the infection. HIV infection, that's the early stage of the infection. AIDS is the later stage of the infection. Like I earlier mentioned, that we have the WHO clinical staging. So stage 1 and 2 can be said to be HIV infection. At that point, you might not really come down with anything physical to tell the person or anyone around you that you're living with the infection. However, your body will give you signals. The problem with us in this part of the world is we wait until things are so bad. One of the things we need to do more as a people, and even as a country, maybe as a state first, before as a country, is that we need to improve our health seeking behavior. Most people don't go to the hospital until things are gone out of hands. We see people visiting TBS. We've been dealing with TBS in those states. We see people going to chemists, self-medicating and abusing drugs. It's actually drug abuse when we self-medicate. You're taking drugs without a doctor or a professional input. So that's actually part of drug abuse. But what we preach, we need to have good health seeking behaviors. You notice anything, the ideal thing is go to the hospital. Go and do some tests. Ideally, the first thing is not even to take drugs. Because what we do when we take drugs is we are masking something, and the real thing is still there. Like you have an headache. The headache could have been as a result of something else. It could be as a result of stress. It could be as a result of malaria. It could even be HIV. But because you have taken paracetamol, and some people are so used to taking paracetamol, some will even say, tablet or shisha for mama, the 1 or those 3, the 1 or those 4. What they are doing is they are not only killing themselves because they are overloading their liver, their kidneys. Those people will die faster of kidney disease than even the thing that is wrong with them. So when we have good health seeking behaviors whereby you have a little complaint, go to the hospital. Let doctors write investigations. Let them clerk you and have investigations written, so that we have a comprehensive test. We have people that do not go to the clinic. They don't even do any form of hospital visits. Then we have lots of people taking herbs. All of these things will only suppress it for a while. So I think it's important and expedient that people pick up good health seeking behavior. You have a complaint, visit a professional and be properly diagnosed before even taking any form of drug. For HIV, when it is picked up early, the person can live an effective, a quality and a productive life, as long as God will have the person live. The challenge with HIV is when it becomes to the WHO clinical staging of 3 or 4. It's defining. We've actually had cases where those stages were even reversed. But it will take lots of effort on both the clinicians, the people in the hospital, to manage that patient, lots of money. Because what the donors are supporting is just the antiretroviral drugs. Other things will come up. HIV is such that it carries baggages when it's coming, especially when it gets to the WHO clinical staging of 3 or 4. It comes with things we call opportunistic infections. They are infections that find their way into the body because HIV has allowed them to come. So it carries lots of baggage. The example is the very common one with HIV is TB. It draws it along. So when we see a TB patient, we definitely want to screen for HIV because they are brothers and sisters. If we have HIV, we need to screen for TB. So we screen for TB. Then there are some other opportunities for infection. Meningitis, it can come alongside with meningitis. Even mental issues. We've had some of our patients develop, because the HIV, like I mentioned earlier on, when it enters the body, it's multiplying, it's replicating itself, and it's attacking the major organs. Even some cancers can come alongside. There are some of the opportunistic infections that come alongside with HIV. So HIV just would expose the person, and it's killing the person gradually and bringing some other things to help it kill the person. It's a destructive disease. However, if it is picked early, it can be properly managed and the person can live a quality life. And that's why we preach, go get tested. And the fact that you tested today doesn't mean you are immune all through the life. We advise that a negative test today should mean that you come in every 3 months to come check yourself. Remember, it's not only through sex that you get HIV. It could be through shops at the salons. It could be from mother to child. It could be through blood transfusion. There are lots of carelessness happening in our clinics these days. Blood not properly screened, or blood screened in the window period, and there is some form of seroconversion. Seroconversion means you screen the blood during the window period, and because the window period is not captured, so you give the person, and then in later years the person comes down. So one cannot be too careful. That's why we preach, go screen at least twice in a year. Okay, let's have some screening. It is even expected that we go for full body disease checkup at least once in a year. I don't know how many of us do that. So